Doctors often recommend chemotherapy as a treatment for cancer. Chemotherapy uses drugs that kill dividing cancer cells and prevent them from growing. Many chemotherapy drugs have adverse effects that can be severe. However, if a doctor recommends a person has chemotherapy, this usually means that the benefits are likely to outweigh any adverse effects. A person will often have chemotherapy as part of an overall treatment plan, which may also include surgery and radiation therapy. These treatments are effective in many cases of cancer. However, their effectiveness will often depend on the stage of the cancer, among other factors. Taking to their doctor will help a person understand what to expect from chemotherapy. Read on to find out more about chemotherapy and what it involves. What is chemotherapy? Chemotherapy drugs treat cancer by stopping cancerous cells from dividing. A healthy body constantly replaces cells through a process of dividing and growing. When cancer occurs, cells reproduce in an uncontrolled manner. As a part of the body produces more and more cells, they start to occupy the space that useful cells previously took up. Chemotherapy drugs interfere with a cancer cell's ability to divide and reproduce. A single drug or combination of drugs can do this. Treatment can either attack cancer cells throughout the body or target specific sites or processes. What does chemotherapy do? Chemotherapy drugs can prevent cell division, target the cancer cell's food source, the enzymes and hormones they need to grow, trigger apoptosis, or the suicide of cancer cells. Some emerging treatments aim to stop the growth of new blood vessels that supply a tumor in order to starve it. Some scientists are concerned that this strategy might encourage the growth and spread of cancer in some cases. However, in 2018, other researchers concluded that it might help some people. Why use chemotherapy? A doctor may recommend chemotherapy to shrink a tumor before surgery, after surgery or remission, to remove any remaining cancer cells and delay or prevent a recurrence, to slow disease progression and reduce symptoms in the later stages. Even if a cure is unlikely, what to expect? Chemotherapy is an invasive treatment that can have severe adverse effects both during the therapy and for some time after. This is because the drugs often target both cancer cells and healthy cells. However, early treatment involving chemotherapy can sometimes achieve a complete cure. This makes the side effects worthwhile for many. Also, most of the unwanted symptoms go away after treatment finishes. How long does chemo last? The doctor will make a plan with the individual that specifies when treatment sessions will occur and how many they will need. A course of treatment can range from a single dose on one day to a few weeks, depending on the type and stage of cancer. Those who need more than one course of treatment will have a rest period to allow their body to recover. A person might have treatment on one day, followed by a week's rest, then another one-day treatment followed by a 3-week rest period, and so on. A person may repeat this several times. Some people may find talking to a counselor about the mental and emotional aspects of cancer and chemotherapy helpful. Blood tests assess the person's health and ensure that they will be able to cope with possible side effects. Liver health. The liver breaks down chemotherapy chemicals and other drugs. Overloading the liver could trigger other problems. If a blood test detects liver problems before treatment, the person may have to postpone treatment until it recovers. Low count of red or white blood cells or platelets. If these blood counts are low before treatment, the person may need to wait until they reach healthy levels before starting chemotherapy. It is important to have regular blood tests during the treatment period to ensure that blood and liver functions remain as healthy as possible and monitor the effectiveness of the treatment. How is the dose given? Most people will receive chemotherapy in a clinical setting, but sometimes a person can take it at home. Ways of taking chemotherapy include by mouth, as tablets, liquid or capsules intravenously, as an injection or infusion topically, onto the skin. In some cases, a person may be able to take the medication at home. However, they will need to make regular visits to the hospital to check their health and how they are responding to treatment. The person must take the dose exactly as the doctor prescribes. If they forget to take a dose at the right time, they should call their doctor immediately. Sometimes, a person will need a continuous dose. This means that they may have to wear a pump that delivers the drug slowly for several weeks or months. They can wear the pump as they go about their daily life.